is Candice and I'm going to be looking at the effect of Donepezil on cognition in schizophrenia patients. Schizophrenia is a serious mental illness with a multitude of symptoms involving disturbances in cognition, perception, affect, and sense of self, as well as motivation, behavior, and interpersonal functioning. Typical symptoms found in patients with schizophrenia during the active phase of the disorder and characterized as positive ones include hallucinations, delusion, disturbed speech, and disturbed behavior, and this can be described as exaggerations or distortions of normal thoughts. Patients also experience negative symptoms outside of the active phase that include affective flattening, alogia, avolition, and anhedonia, which involves functioning below the level of normal behavior. Common method of treatment usually involves the use of medications such as antipsychotics and anticholinergics to lessen the extrapyramidal symptoms, accompanied by therapeutic interventions such as psychotherapy, cognitive behavioral therapy, and sometimes cognitive remediation to enable individuals to cope with the debilitating effects of the disorder. The questions for this research paper was, does the efficacy of current treatments for schizophrenia outweigh the extrapyramidal symptoms commonly seen in patients on antipsychotics? Also, why do patients on antipsychotics continue to experience debilitating effects in cognitive, occupational, and social dysfunction even after treatment reduced the positive and negative effects in schizophrenia? As for the literature review, we found that cognitive dysfunction may be termed as one of the more enduring deficits in schizophrenia, as it is linked to an impairment of the temporal and frontal regions of the brain associated with cognitive function, as well as the subcortical regions that work closely with them. This syndrome may underpin parts of the psychopathology of schizophrenia. However, it may also contribute to occupational and social impairments commonly seen in patients. Although cognitive dysfunction is thought to be independent of psychotic symptoms, it can be seen as a more lasting severe effect of the disorder that can affect the quality of life. Neuroleptic drugs are widely agreed upon as a good form of treatment. Studies have shown that they do not have any benefits on cognitive function and may actually lead to further cognitive impairments. The hypothesis were, are the cognitive impairments as important as the positive and negative symptoms regarding schizophrenia and its impact on quality of life? And does cognitive enhancers such as Donepezil, in addition to atypical antipsychotics, help to reduce cognitive impairments in schizophrenic patients? For the participants, 200 patients diagnosed with schizophrenia from a mental health inpatient facility were selected to participate in the study. Participants were assigned to either the experimental group or the control group. A demographics and background analysis was conducted in order to match the participants for comparison over an 8-week period. Patients were asked to complete a pre-test survey regarding the presence of positive and negative symptoms, several aspects of cognition, and to perform the computerized neurocognitive function test. After diagnosis of schizophrenia was confirmed with the institutional psychiatrist, atypical antipsychotics were administered as up to 10 milligrams of Donepezil for daily usage. Participants also completed several cognitive tasks and reports on a weekly basis for the entire duration of the study. For the control group, only atypical antipsychotics were administered to this group. However, they were required to perform the same cognitive tasks and surveys as the experimental group for the entire duration of the study. We used several assessments. Participants were evaluated based on the positive and negative syndrome scale, schizophrenia cognition rating scale, and computerized neurocognitive function test. Other surveys were conducted and included a daily self-report measure administered by the nurse practitioners. With regards to the results, both groups showed an improvement concerning the reduction of positive and negative symptoms. The experimental group demonstrated significantly higher improvements in attention, memory, psychomotor speed, and mental set-shifting ability. The post-test survey indicated that the experimental group also showed an improvement in cognitive, occupational, and social integration. Both hypotheses were supported by the data, showing that cognitive function is an important factor concerning the improvements in cognitive, occupational, and social integration. The data also suggests that certain cognitive enhancers such as Donepezil help in improving cognition.